A new grant program is hoping to give local organizations an upper hand when creating programs designed to improve your overall health.
Yeah, it comes as the COVID-19 pandemic continues to reveal health disparities across several communities in our region and really across the country.
NBC5's Adrian Pastor joins us live in the newsroom with why health officials are relying on these types of programs.
Yes, Sarah Beth Zuri, after a more normal year since the beginning of the pandemic, health officials are still assessing just how deeply communities across the state were impacted. The grants are seen as a small step in the effort to create a more equitable healthcare system for everyone. While the COVID-19 pandemic pushed the healthcare system to its limits, it also served as an opportunity to think about public health and reevaluate what health and wellness can look like across communities.
This was an enormous opportunity for us to build some health equity infrastructure and also to use some of that money to grant to community organizations, particularly those who we haven't worked with in the past.
How it works? Through the Center for Disease Control and Prevention, the Vermont Department of Health and Vermont Community Foundation has given over $4 million in grants to local organizations throughout the state. Each organization is actively working to curb health disparities among communities who were hit hardest during the pandemic, including BIPOC, Indigenous, and people who live in rural communities.
We have lived through a pandemic once and it didn't work out so well for us. So my goal as a leader and the executive director of our nonprofit was to find ways to help reduce those health disparities.
Abenaki Helping Abenaki is one of 30 organizations receiving grant funding. Chief Stevens says the goal is to use the funds to maintain its food distribution programs and expand preventative care options, along with finding ways to secure health care for its members who make up 2% of the state's population.
We know that representation matters.
And in Rutland, Come Alive Outside is hoping to see more people take advantage of their outdoor adventure programs, helping them find their love for nature at their own pace.
We have been really working at looking at these barriers and being like, actually being outside for 20 minutes a day, whether that's taking a walk or sitting on your porch or laying in your hammock or just walking around the grass, that has a ton of health and wellness benefits. And then you can find whatever your joy is in the outdoors.
My hope is that this opportunity also kind of fundamentally shifts the way that we work with communities and really have a commitment to doing equity work to right some of the wrongs of the past.
And health officials say they're looking ahead with hope for more opportunities to continue to strengthen their public health infrastructure, reiterating that change begins at the local level. In the newsroom, Adrian Pastor, NBC5 News.